When I started analysing data from the Whitehall study of British civil servants, there were two ideas around that I had to grapple with. One was people of high status suffered stress because of their job and their situation, and that stress led to heart attacks and potentially death from heart disease. That was one idea. High status people under stress. The second idea is it's not very good for your health to be poor, and poverty's linked to ill health. The Whitehall study of British civil servants excluded the very richest, and these are all public servants. So no bankers, no hedge fund managers, no tech billionaires from Silicon Valley. It excluded the richest, and it excluded the poorest. They're all employed. Low-grade civil servants aren't paid very much, but they are employed. They're not the poorest. And what we found was there was an intimate relation between level in the hierarchy and risk of death. The lower in the hierarchy, the higher the mortality rate. And it ran all the way from top to bottom. Those second from the top had higher mortality than those at the top. The clerical officers had higher mortality than their managers. And the office support grades, the messengers and doorkeepers and the like, had higher mortality than the clerical grades. So it ran all the way from top to bottom. And that's what I call the social gradient in health. People say, well, we don't quite understand what you mean. What I mean is classify people by, in the Whitehall study, by their level of employment, seniority in the system, and you find that the higher the seniority, the lower the mortality risk, the longer the life expectancy. And it runs all the way from top to bottom. Subsequently, after doing the Whitehall study, and we launched the Whitehall 2 study, subsequently, we've looked at other ways of classifying people, not just seniority in the employment system, but years of education, or classify people by where they live, classify where they live by an index of multiple deprivation. And what you see is the greater the degree of deprivation, the shorter the life expectancy. And it's a gradient, runs all the way from the least deprived to the most deprived, from the top to the bottom. Now, in the Whitehall study, the first Whitehall study, what we looked at as explanations for the gradient was smoking, plasma cholesterol level, blood pressure, body weight, all the usual conventional risk factors for heart disease. And what we found was those risk factors explained perhaps a third of the social gradient. So people down the bottom were more likely to smoke than people at the top. And that's important. But smoking and those other risk factors explained about a third of the gradient. And I launched the Whitehall 2 study, a second study of British civil servants, with women as well as men this time, to look at other potential explanations related to the nature of work, stress at work, other aspects of nutrition, to understand the reasons for the social gradient.